Hi, my name is Zaina Salvador.
And I'm Caitlin Shoei, and we're both second-year NHACC students at the University of Washington.
Our interest in climate action within the healthcare space truly started within the first term of our first year within our MHA program. So we both grew up in the mountains, and we both have a deep passion for the outdoors, but we were also exposed to the integral connection between climate health and population health. We then had the opportunity to attend a health and climate-focused symposium at a local Seattle health organization called Virginia Mason. At this symposium, we realized that while providers are leading the conversation in this space, healthcare administrators should be right along with them. The health impacts that climate change brings is a pressing issue that we as health administrators not only need to be talking about, but outfitting ourselves with the right tools to mitigate it for the health of our communities.
So climate and healthcare aren't often things that are really paired together. And some of the questions that Zaina and I get are just, why is this important to the healthcare industry, and what does healthcare even have to do in this conversation? So just to give a little bit of statistics and some background, studies have actually shown that the healthcare industry in the United States is responsible for about 10% of the greenhouse gas emissions. There are also some other studies that kind of show that the healthcare industry is responsible for the loss of about 47,000 disability-adjusted life years each year. And these are years lost due to ill health, disability, or early death. So when Zaina and I were kind of doing our research around MHA programs, we really found that barely anyone in the MHA space was talking about sustainability or incorporating it into their programs. And we thought that this was kind of frustrating and confusing, especially because sustainability directly plays into the mission of improving people's health. And we also feel that as leaders, this is kind of an opportunity not only to do no harm, but also to do good for the communities and the patients that we're serving.
So as Caitlin kind of just mentioned, there wasn't a whole lot of talk around climate and health going on in the MHA space, and we really wanted to be the ones to create that. And so we did that through the National Health Administration Climate Collaboration, or what we call NHACC. And our mission is to advocate, educate, and act for sustainable health systems. Ultimately, we have a vision that we can create health systems that work in synergy with ecosystems.
So within NHACC, we actually have 3 committees. We have education, community engagement, and then also advocacy. They're all full of these bright, driven MHA students around the country that are really working on kind of making the environment a priority within healthcare. So our committee chairs will go into a little bit more detail about our work.
Environmentalism and sustainability work are all about action and giving voice to movements that matter. My name is Caroline Voldman, and I'm the Advocacy Committee Chair for NHACC. The Advocacy Committee functions as a loudspeaker and a liaison. We work to promote progressive policy by amplifying messages about environmentalism and facilitating connections with the community spaces we occupy. Our committee asks questions like, where does the healthcare industry make its biggest impacts on the environment? What's being done about it, and what policy work is needed to enable change? And most importantly, how can we express support for those policies to the healthcare leaders and legislators that will bring them to life? If you think about it, we as a generation of health administrators are uniquely positioned to prioritize the planet as we enter leadership roles in the industry. I hope you'll join us at the next advocacy meeting to get involved.
Hi, my name is Allie Sherman. I am an MHA student at the University of Missouri and am the Education Chair for NHACC. The Education Committee focuses on connecting our vision of having climate-smart healthcare leaders to the curriculum and core competencies of leading MHA programs across the country. We're really focused on enhancing sustainability education for future healthcare leaders. Not only do we engage and partner with program directors, professors, and other academic leaders to promote climate education, but we also provide tools and resources that are needed to successfully teach healthcare leaders how they can have an impact on climate change.
Hi, my name is Mary Jane Schaefer, and I am the chair for the Community Engagement Committee. Community engagement is really about interacting with our NHACC members as well as with organizations in the cities that we live in. Our mission is to build our NHACC community, to elevate the voices of our members, and connect with our communities to continue working toward a sustainable future. Some short-term goals we have been working on are developing our NHACC website and social media materials. Our long-term goals include increasing and sustaining our membership, sending out our monthly newsletter and any promotional or educational materials to our committee members and the general public.
Thank you so much for listening.
We can't wait to see where this goes.
See you later.